Well, thank you very much. Those of you who don't know me, I'm Jill Hollis, and I'm one of the committee members. But yesterday, when we were talking about this session this afternoon, they said, Jill, perhaps you could introduce panic to the meeting. Now, there's a number of ways I could do that, most of which in my head sort of remind me of Dad's Army. But that's not what we're doing today. We have got just the man to help us talk about panic and anxiety and hyperventilation. Neil Holden, who's a consultant psychiatrist, and he told Anne that panic attacks are his bread and butter. So if there is panic here, we've got just the man to sort it out. So I think more seriously, the reason that we wanted to cover this subject is that on Lamline, our email chat group, it's a topic that comes up time and time again. And for the person who suffers from it, it always seems a little strange and unusual. And so it is definitely worth talking about because as a group, we do seem to be more vulnerable to panic attacks, anxiety, hyperventilation. And there's some really useful sort of tips and things about that. But I thought we might start off just by I know there's lots of us, including myself, who have suffered from one of these issues from time to time. But I had one volunteer, well, not quite volunteer, there was a bit of arm twisting. Annie was just going to give a quick summary of her experience, and then we'll hand over to Neil, sorry.
I was diagnosed 2007, but I was not really a very anxious person, but I started getting anxiety, a full-blown panic attack in January last year. It just came on. I'd had a prang in the car 3 days before, everything was sorted out, no injuries, nothing like that. And then 3 days later, my husband's birthday, we were at our favourite restaurant, and it suddenly went cold, clammy, just a terrible sense of dread, just wanting to get out of there, feeling surreal, sweating. And in the end, we had to have doggy bags and we went home and then it kind of went. But from that point, I was pretty much housebound for 3 weeks, dealing with the underlying reasons for it, which was memory from when my lung collapsed. But, that was a trigger moment for me. And then we worked through it with techniques, which probably Neil will explain, and I'm a lot better now.
Okay. I did check with Annie before it that even talking about it wouldn't start bring it back, because sometimes that can be a problem. But Neil, can I pass over to you just to, first of all, just set the scene? Is this a sort of typical experience?
Now, Megan, can you hear me all? Yeah, all of you? Yes? I suppose the first thing to start by saying that everyone, if you say anxiety, do you get anxiety? Some people will say, no, I never get anxious. And other people will say, yeah, I get panic attacks. The honest people about us will say that. But anxiety is something which we all get. We all have anxiety. Why do I say that? Because it's anxiety that stops us from doing ridiculous things. It stops us walking out in front of the road when there's not enough time. It stops us. It keeps us on edge. It is part of the normal process of our brains is to keep us aware, and it's linked in that sense to something which we call arousal. And for those who deny ever being anxious, the next question will do you ever get angry, or do you ever get excited? Because arousal, which occurs in anxiety, is exactly the same physiologically, bodily, in anger and in excitement. So the symptoms that we recognize as being how you get if you're anxious, flushing, sweating, short of breath, are exactly the same things as you get when you're excited, or exactly the same thing you get when you're angry. Some people say that the only difference between suffering anxiety or anger depends upon the size of the person opposite you. You know, that if they're bigger than you, you get anxious. If they are smaller, you stand up for yourself and get angry. The process of panic, of course, is usually regarded as a very much more intense form of anxiety with the same symptoms. Now, I don't really need to sit here and tell you as a group what symptoms you get in anxiety, because we've all experienced anxiety. Anxiety before job interviews, exams, someone runs into the back of your car, you get anxious, and you have the symptoms of anxiety with palpitations, churning of your stomach, feeling sick, choking. Every system in the body is affected by this arousal, this process. So you think the nervous system, you get shaking, you get headaches, you feel tense, your muscles become tense, you can get pain associated with that tension in your chest. People end up in A&E with panic attacks, saying, I'm having a heart attack. Why? Because they're tensing up their chest. In terms of the symptoms that affect the gastrointestinal tract, people get diarrhea. Some people paradoxically get constipation. They get churning. And all these symptoms are perfectly normal. And we all in this room will have had them to some extent at some time. But where it becomes difficult is that sometimes these panic attacks come on in situations where you don't feel anxious. The man who suddenly gets chest pain and rings 999 saying, I'm having a heart attack, take me to casualty, isn't actually thinking, I'm anxious. Well, he may be aware of being anxious because he'd say, well, it's because of my chest. It's because I'm getting pain. And so they put the cart before the horse in that perception and don't say, I feel anxious, therefore I'm getting these symptoms. They see it the other way around. The difficulty for you as a group of sufferers, now you're the experts in this condition. Before Anne rang me up, I'd barely heard of the condition, and obviously you're the experts. You know how it affects your breathing as individuals. But the trouble with this is just in the same way as people's bowels are affected, people's nervous systems are affected, the chest is also affected, and people get characteristically short of breath. As I said, people who are excited get breathless because they're excited. People who are anxious get breathless. And there's nothing unusual about that. And of course, after the anxiety is settled, it will return to normal. There are situations where the anxiety can be chronic and can become a chronic pattern of breathing, but the question is, if you suddenly get a deterioration, there's two possibilities. One is that something has happened, an intercurrent illness, chest infection that you've got coming on. But the other alternative is this could be anxiety, and that is actually good news because it's entirely treatable. Now, I don't know whether you want this, the danger of this becoming me lecturing you. How many here suffer from very clear panic attacks in their everyday lives?
Have at some stage. Yeah,
so a fair few. It's not a rare occurrence. And of course, you're not alone within your illness suffering this, because it is very, as Anne would obviously tell us, it's very common in people who've got asthma being a much commoner illness, but with some overlap of symptoms with what you've got, and they get it. And sometimes the typical story with the asthmatic is an asthmatic who may have had mild asthma during their lives will have a very bad attack of asthma for some reason, whatever. They've had contact with allergens or something that set them off, pollen count being high or whatever. They end up having a real crisis, coming to hospital, and they get discharged then after a few days, a week of steroids and being settled down with various medications. But of course, when they go home, as soon as they feel, for whatever reason, just a little bit more short of breath, what they think is, oh my God, it's coming back. And that feeling makes them immediately think, gosh, I better watch this. It seems to be getting worse. And as they latch upon it as a symptom, the more you think about it, the more it gets worse. And so in a way that becomes like a rolling stone, a vicious circle, which makes this far, far worse than it really should be. And that's the anxiety component. The more you think about it, the worse it gets. Now, associated with that, you do various things. One is you open your mouth and you start to breathe in that way rather than through your nose, or perhaps if some of you have got severe problems, through your pursed lips, which sometimes helps breathing. So you switch from nose your normal style of breathing to one where you're opening your mouth. And with that, you tend to hyperventilate, you feel you're short of air, therefore you work harder at it. And you lift your shoulders up, and you're really pushing at it as if you've just been running a mile. And what you've got to try and do is to reverse that behavior consciously so that you try and breathe through your nose. It's very hard to hyperventilate through your nose, but trying to do that will make you feel more in control. And if you can try and relax, get your shoulders down, drop your shoulders, drop your arms, you will also find that helps. And then the conscious approach to trying to say, well, this, I know what it is. It's not something to be frightened of, even though it is fear itself. And I need to start thinking about what else is going on. What set me off in this? What's happening to me? What else am I getting? Now, of those who do get panic attacks or who've had them, do you remember what happens to you after a little while? What does it feel like, apart from the shortness of breath? Do you get any other symptoms?
It's exhausting.
It's exhausting, absolutely. Obviously, it's very, very tiring.
Dry mouth.
Dry mouth from, obviously, the air passing over it. If I were to be talking to a group of medical students, I might actually set them off doing a session of hyperventilation, just for fun. And I would say to them, well, we're going to do it for a minute, and I want you to breathe. And you see my shoulders are lifting, and I've already opened my mouth. And if you do that for a minute, and then you stand up, you can guarantee the symptoms that those students, as healthy individuals, volunteers, you can guarantee what they'll get. They will feel hot, faces will be flushing. They will feel that they have a dizziness. Some of them will describe tingling of their mouths, noses, fingers, possibly feet. And this is all due to breathing off carbon dioxide. And by doing that, they make themselves less acid inside, because carbon dioxide is acid. And the result of that is they get this tingling in their fingers. And of course, when that starts happening, you start thinking, well, my goodness, what's happening to me? This is something awful. And it again accelerates this vicious circle. So much so that what we generally tell patients, as this is a psychiatrist, and perhaps it might be frowned on by others, is the classic thing is to say, get a brown paper bag, and you breathe into this bag and breathe back in from the air in the bag. Now, I would probably need to turn to Simon or Anne and say, well, I don't know what that does it would do to someone with Lamb syndrome, because of course you're not quite the same as an average person in that sense. But the danger is that by the particular pattern of behavior that you're getting into, that you're just creating for yourselves a set of symptoms which you need not have. And it becomes this vicious cycle, and all the time your anxiety is getting worse. Now, sorry.
I was just going to say at this point, because what Annie was describing was very much a panic attack.
Yes.
What I had was very much more a sort of chronic version of heightened hyperventilation, where I had got into a habit of hyperventilation.
Yes.
And I was just explaining to Neil earlier that in my case, I'd had a chest infection. This was pre-transplant. Had a chest infection, was going on holiday, a walking holiday, wanted to get fit, so went to the gym and probably did that classic, breathing through the mouth, and got into that pattern. My breathlessness then increased hugely, and I ended up seeing my consultant saying, I think my lamb's got really, really worse. And he turned around and said, no, it's not, but you're breathing at 60 breaths a minute, whereas you should be breathing at somewhere between 12, 15. So I had got into this pattern of hyperventilation, which is exactly the same thing, but on a chronic basis. And it was very hard to kick. So I think there's the classic attacks, but there's also this, sort of constant anxiety.
And I think that the process is very similar. It's just that obviously one is long-standing and becomes ingrained in behaviour, as you're describing. The other is shorter term, associated probably with more overt, obvious anxiety of, my goodness, what's happening to me? And obviously, the two conditions have great similarity. They have some differences in terms of how they are developed. Because, of course, when the panic attack has passed, the sufferer is back to normal, and the question is, how do I prevent another one? Or how can I be aware of another one? Whereas when it becomes chronic, the question is, what can I do about my behaviour to reverse it? I suppose that really then comes on to what can we do about it. And I suppose just as a plug for my own profession, I'm a psychiatrist, but I'm not a typical psychiatrist. What does that mean? I always feel very wary about saying typical psychiatrist, because does that mean I'm more or less mad than my colleagues? But I'm a liaison psychiatrist, which means I'm a psychiatrist working purely with people who have physical problems in a general hospital setting. And most big areas have a liaison psychiatry service, which is useful for you to know because those psychiatrists and the staff they work with have a lot of experience in working with people who have got, whatever it may be, asthma. They won't have a lot of experience in LAM because obviously they won't see it very often. But they have a lot of experience in asthma, which has very similar what should we say, skills needed, required. They have a lot of skills in working with the principles of the problems of physical illness. And that is a resource that you should be able to tap into if you are running into problems. Now, if you're in a smaller town or city, you may have more difficulty accessing a service because it probably is not very well developed. But there usually will be a liaison nurse, or alternatively, the possibility of a referral to one of the larger centres that obviously will be associated with your respiratory care as well. So that's just a little plug. The two approaches are broadly divided into medication on one hand and to psychotherapeutic type approaches on the other. Now, when I say psychotherapeutic approaches, which of course really is the most ideal approach, I'm thinking very much about behavioural approaches. The paradox of this, of most behavioural approaches to respiratory problems come from physiotherapists who are attached to the respiratory units and who can teach new breathing patterns, trying to get regulating the breathing, dropping shoulders, breathing through mouths, teaching individuals to relax in a very basic way of relaxation therapy. And these are behavioural approaches. They're not requiring anything. They don't assume that you've got psychological problems. They are just simply trying to tackle the behaviour. But people now link to it what's called cognitive behaviour therapy, which is a process of looking at the thinking behind all this. What's going through your head? Oh my God, I've got a problem here, something's getting worse, something's happened to me, I must get help straight away. Those sort of things can be tackled as well by that approach. And then the other side to all is, well, are there medications if you are really getting very anxious associated with it? There are some very helpful medications. Some you have to avoid because of the illness. So-called beta blockers shouldn't be given because they affect your airways. But other drugs can be used, particularly in the situation maybe where you find that someone is persistently anxious, where if you can actually demonstrate that by making their anxiety less, by giving, say, something like diazepam, Valium, for a very short time, maybe just for 6 hours or something, it can actually allow them to feel free of anxiety again, as almost like an experiment. So I'm not suggesting any of you become junkies, just simply that medications may have a sensible use at times. But a lot of this is about behavior, it's about dropping shoulders, breathing through the nose, and generally getting into relaxation mode, trying to challenge that idea, oh my God, something has happened to me, what's descending upon me at this moment.
I know that at previous meetings we've actually talked about breathing techniques and had people come and demonstrate good breathing techniques, which I think goes very much hand in hand with this. The one thing that I struggled with personally, and I think it's this association with anxiety, does that mean you're an anxious person? I think both Annie and I were saying we're not naturally anxious people. And
I think stigma, the idea that somehow I'm being told this isn't in my lungs now, it's in my head, I think is the wrong direction to go in. We all have a head, we all have lungs. The relationship between the two is something that is there with all of us. These are very complex mechanisms in terms of our breathing, in terms of what we think. We all have anxiety. Anxiety affects all of us. At times we will be short of breath because we're anxious. It happens to me. I don't mind admitting that. Before a situation like an interview or somewhere where you're put on the spot, you will feel symptoms of anxiety, which will include feeling short of breath or being vulnerable to be short of breath. It's not just the idea that it's anxiety does not mean that this is in any way your fault. And that's very important to recognise.
Why is it as a community women with LAM are more susceptible then? Is it because the respiratory disease?
I think that you are sensitised to your lungs because you are worried that, am I going to get some form of sudden decline of my lung function at some point? And that worries you so that you're watching it. Now, one of the features of anxiety is that we all become what we call introspective. When you're worried about something, say you're worried about, you've had an operation on your tummy, you think about your tummy all the time afterwards, wondering, is this gurgling something that should or shouldn't be there? Is it working right? Isn't it working right? You start to concentrate on it. Now, when you do that, it makes you anxious. It makes you focus on it. You become very aware. So you are, as a group of sufferers, probably more aware than the average person about breathing. You remember as a child that game that sometimes people try and control their breathing as a child, and when they do so, they almost forget how to breathe in an involuntary way and can almost make themselves anxious. And it's a bit like that. The more you think about your breathing, the more it feels as though it's a conscious effort. That then creates anxiety for you.
Sorry.
Yeah, no. Yeah.
Well, I was just going to say that I've never had a panic attack as such, but I do remember a time when I was going for an interview or something which was obviously a bit stressful, and having to climb a flight of stairs. And when I got to the top, I was breathless, and I thought, well, you know, normally I wouldn't have been breathless at that point. And that's because I was hyperventilating as part of the anxiety,
Yes.
as you've described. Now, I had normal lungs, but if you've got a limited lung capacity and you start to hyperventilate, then you just don't have the capacity to do it comfortably. I mean, so I think it is the lack of capacity to be able to hyperventilate, which is why LAM patients have a particular problem, as do patients with asthma. And the other thing, whilst we're about it, I used to occasionally get patients to hyperventilate in the clinic for a minute, not if they were very high, you know, low oxygen at the time, but it was very useful because they'd say, yes, of course, you know, those are, I'd say, are those like the symptoms you've been getting? And they'd say yes, and that's half the battle to, if people know it's due to hyperventilation and the vicious cycle due to getting rid of carbon dioxide, as you explained, then...
Yeah, I mean, I always find myself most short of breath when someone says, there's a phone call up in your office upstairs, and you go up 3 flights of steps, you're wondering who's on the other end, you don't want to sound as though you're sort of heavy breathing them on the phone, and by the time you get there, you're completely short of breath, and you're also extremely aware of it, that you're about to stumble over your words because you are going to be short of breath. And it's situations like that where there's this mixture of feeling you've got to perform, that question of what's going to happen to me, am I going to let myself down, am I going to collapse in some way, am I going to literally feel, am I going to disgrace myself or create a fuss that makes people far worse. And it's about trying to say, no, it doesn't matter, this isn't important. What's important is just I calm down, breathe in a controlled way, use what I've been taught in the best possible way to try and take control of a situation. But it's not very abnormal, yes.
I was wondering if it helps kind of avoiding stimulants with anxiety. There's teas, coffee, sugar.
I think everyone is different, and just as you go to a dinner party and there'll be those saying I want decaffeinated and there'll be others who are saying no, I want give me an espresso. People have their choices in respect of sleeplessness. Exactly the same way some people find that they as a result of having stimulants of one sort or another will find themselves worse. And it's about trial and error. If you feel empirically you're worse after tea, coffee, and of course that's tea and coffee have vaguely got effects on your lungs, so possibly slightly positive. So it's a spin-off, isn't it, in these situations? So try it out for yourself. Do a controlled trial. See what you feel, whether it makes a difference. But certainly, some things do make you more anxious. There's no doubt about that. Some things that we do or eat or whatever will make us worse.
Yeah, I was wondering. I think quite a few people experience this intense urge to go home. They feel the sense of kind of unsafety and think, or if I go home, I'll be safe. And obviously, should you sort of listen to that urge, even though you know it's irrational? Should you? Is there a way to kind of calm yourself, even if you're not going home?
Well, classically, that is exactly what if you say, well, what is the definition of panic? It usually involves an element of getting out of the situation you find yourself in. So you become sensitized to a situation. So if you've had an episode that's maybe associated with going into Asda, not that it's Asda's fault, but you have a panic attack there. When you go back into Asda, you think, will it happen again? So if it does happen again a second time, there's no way you're going to go back again. You actually then start saying, I will avoid it. Or you take someone with you, or you do something differently about it. And that you can see how that reinforces it. Each time it happens, it gets worse. So if you find that in queues generally, you find yourself getting tight in your chest and I really can't stand being in this queue, I must get out, that will get worse each time you leave a queue, because you associate, I'm in a queue, I'm going to get short of breath, so I will leave it. And that then becomes a real disability, because we're English, we've got to queue. So, you know, it really does become a disability. So you need to try and resist that urge to get out. Yeah, it's different from about putting yourself in a place of safety when you need to be in a place of safety. But in general, if it's about a panic attack, you need to try and stick with it. Use those techniques in situ where you are, trying to control your breathing, dropping your shoulders, breathing through your nose and thinking, I'm going to be all right, this is fine, I'm just, anxious because this is that set of circumstances yet again, I know what's happening to me.
I'm one of the people that would have said, no, yes, I worry. I'm a mother, that's what mothers do. But I would have said I don't have panic or anxiety attacks. But when I first went on oxygen, after about 6 months or so, my osteopath was, because I kept saying, oh, you know, my neck's really tight every time I went. And she said, that's because you're using your auxiliary breathing muscles all the time. So I was literally using my shoulders to breathe. And we worked out that was probably because my brain was saying, you need to breathe more because you're on oxygen.
Yes.
And so by sort of knowing that that was what my brain was saying, I could tell it, don't be stupid, I don't need to breathe more because I'm on oxygen.
And telling yourself that I'm not going to be stupid, I'm going to keep control of this, I know what I'm doing. That's what we call the cognitive bit. The breathing bits, the things that you're taught, that you work through with your physio or with about dropping your shoulders, not using your accessory muscles. Yeah, use your diaphragm, get back to what you normally do. Yes, that's right. You then find that you're conquering it. And of course that is marvellous, that it gives you more enormous confidence when you can deal with this.
I must say, I mean, personally I found breathing exercises and being taught to breathe properly and was some of the best lessons I got. So it's definitely something to ask about again if any of you are thinking about it.
Breathing exercises when I was I had breathing exercises when I was first diagnosed, and just to kind of lie down and breathe from the stomach, from the diaphragm. And I find when I'm getting very anxious and I'm out, and I do find I can tell myself to slow down, to breathe from my stomach, and it takes a while to get from the head to the stomach, you know. But yes, it does help. The only thing where it doesn't help is I'm quite claustrophobic, and I can't cope with anything covering my face. So I have problems with things like going to the dentist.
Yes.
Even though I'm only going for a checkup and I know that I'll be in and out in 5 minutes, I've still got to go in. So I must admit, my GP has given me diazepam.
Yes.
But it's just for
the dentist.
For the dentist.
No, absolutely.
An hour before the treatment.
Yes.
And I must admit, I can understand why people become addicted, because the feeling of calm is lovely.
Yes.
You know, I really can understand it. He can do anything, and I'm laying there thinking, I'm sat here and I'm not upset.
Well,
but yeah, Will comes in, I don't take it all day, I just have the one.
Well, I mean, of course, you're probably aware that, you know, a double gin and tonic will probably do the same, but then of course you might smell of alcohol. So, you know, these are not, there's nothing magical about medication. It's simply a tool for a job, and if you need that, you know, you've got an issue about dentists, you can either deal with it that way, or you could try and get your GP to refer you for some sort of basic behavioural counselling. The trouble is, as you probably many of you have discovered, and that is people are scared off by psychiatric staff or psychological staff are often scared off by physical things. Oh, I don't know anything about that. So,
any kind of treatment where it's around my head,
Yes.
I'm just a dentist.
Yes.
I mean, you can inject me here, there and everywhere, and I'm not wherever you want to be. But the thought of something happening around here and Amy just, start to catch.
Yes.
I don't particularly know. I'm also a bit the same about lifts. A kind of small metal lifts with no gaps. I just slip it in and there's no way I'm going back. Big, in the big area was okay. And especially big, small lifts with lots of big men in.
I don't know, some people might find that quite attractive.
Chest within there.
Does anyone else have any more questions for Neil?
I identify with the description of the over-breathing, the overheating, but what's the great unmentionable when you start to wet yourself, you're out catching a train to go to work and you think, oh my God, I can either breathe or pee, and I think I've got to breathe or else I'm going to die. And you're actually standing in the station at the lift, luckily there's no one near you, and you realise you're going to actually wet yourself in public. And is there any way you can stop that happening? I mean, in my case, I just have to go back home again, phone works, I missed the train, sorry, we'll be late. Didn't actually admit why I was going to be late, but just like you were talking about Asta, the next time I was going to work, I just was approaching the station and I could already feel myself, oh God, don't let it happen again, don't let it happen again, even though I'd been to the loo maybe 3 times in 10 minutes before going out, in case it happened again.
And of course...
Is there anything that you can give us tips for there?
Well, it's a common fear in panic attack that people they get a feeling of frequency, a feeling of desire to empty their bladder. If they've got a full bladder, then of course, yes, there can be problems. The thing is, it actually is less common than most people, certainly those who are frightened of this happening, imagine. And, as you rightly say, what's happened after that one episode, which has sensitized you, is that you now are fearful wherever you go of, oh my goodness, it might happen again. This isn't a problem just for people with panic attacks. It's said that when Edward VIII was given, the only piece of advice he was ever given by his father, George V, was whenever you go past a gents' toilet, use it, because you might never see one again during the rest of the day. And in a sense, having an empty bladder, as you rightly have found yourself, is an extremely good way of controlling this, because you will still, even though you might only have a teaspoonful left of urine, you'll still get the sensation of, oh my goodness, I'm going to have an accident with it. But you've left the house having emptied your bladder. You've not had 3 cups of coffee before you've left because you're sensible. And so actually there isn't anything there. It's just a sensation. Were you, and this gets terribly personal, but were you to have a tiny accident, nobody would notice. And again, that's the other thing about this. When you actually have had an accident, we're all extremely conscious of that. And I say we all because I don't think anyone in this room has never had a urinary accident of some sort or another. And so, it's not noticeable in 99.9% of times. If obviously circumstances do occur where it might be, and that can be upsetting, but usually you don't have to go back home. And these are the sorts of things that logically you need to recognize, tell yourself, and to address in that sense. Beyond that, there is the question of what triggered the anxiety, what triggers it, is it a particular setting or a particular set of triggers? Can you desensitize yourself to those triggers? So that idea, I'm leaving, I'm in a rush, I'm trying to catch a train, whatever, so you give yourself more time, you plan a little bit differently, you take yourself to stations in other ways so that you know that, and so on and so forth. There are ways of trying to plan around it. But generally, because anxiety is so common, we do know that people aren't all the time being incontinent as a result of it. It's a fear of being incontinent rather than incontinence, usually. I hope that helps.
Yes, it does. I think you were saying about address it in a different way. I think one thing that helped me was to see there was another train 15 minutes later. So actually, if I just stopped in my tracks when I was getting breakfast,
yes.
Let it go.
Yes.
Let it go. You're going to miss it. There's one coming in 15 minutes. Instead of thinking, I've got to get that one, I've got to get that one.
Yes.
So now I've got the timetable written in my diary, and I'm actually every 20 minutes to half an hour. So I try and go for the one before the one I really want.
Yes.
But it doesn't matter.
And you also see how this is an experience that we have all had. That is, I've got to be there for such and such a time, or else I will miss a train, I'll miss the beginning of a meeting, I will, something will happen. You pressurize yourself, and what do you get? You might say, you might recognize as I'm anxious, but equally you might just say, well, I was under pressure, I was stressed, or I was excited. And they all have the same effect. And it's about trying to recognize that there is nothing abnormal about that situation at all. It's how you then build layers of belief on top of it about that makes it something that it's not warranting.
Well, thank you very much. I'm not seeing any more hands up, but say Lamb Action, you can get everything from happy pills to cake in one session. But I think seriously, Neil, what we've just talked about is something that does affect, all of us in the room to some extent or another. The Lamb patients, some of the Lamb patients particularly susceptible, and even just that feeling that it's normal, just it sometimes is part of the condition and makes us more susceptible to it. That in itself is quite reassuring, I think. But you've given us some very useful tips on how to handle it and think about it as well. So thank you very much.
Thank you.